So when did you begin working in substance use disorder or addiction recovery treatment? And kind of what led you to that?
So I started about, let's see, 8 years ago now, and working in the field. What led me into that was, growing up, my father experienced a lot of mental health issues, depression, anxiety, things like that, but eventually kind of trickled into a gambling use disorder. And there's a high comorbidity between gambling, addiction, and suicide, and eventually lost my father to suicide in 2012. So just, and at that time I was starting residency for, internal medicine. So that kind of changed the trajectory of my interest and my path and my, I guess, passion for helping people. So once I completed my internal medicine residency, I kind of changed I still do internal medicine, but really changed my focus over into addiction medicine and diving into that world and helping people.
Yeah, it's tough. I'm really sorry to hear about your losing your father that way. And I mean, it's one of those things that impacts so many people. And remember hearing early on when I was working in at the state level, like different statistics around just how many people are impacted and how many people know someone or have a very close loved one that's, struggling with some sort of whether it's mental health or a substance use disorder. And it's pretty staggering. And what I remember too with working in that space for a long time is it seemed like even in the jobs I was in, like coworkers and stuff, it seemed like most people there were there for similar reasons. We had, I know my family's been, impacted and had, people affected by it. And it just seems like it's one of those things that it's just so many people are affected by it and know someone who also struggles with a substance use disorder or a mental health condition or both. So it's just one of those things that's really, really widespread and has a significant impact on multiple levels. Um, so tell us a little bit about how you kind of integrated like what I always often refer to as the whole health approach, where thinking about the physical health, our body, our mental health, and our mind, but also the spiritual aspect, or kind of our soul. How do you kind of take that integrated approach and supporting people that are in addiction treatment and recovery? Kind of how did that evolve, and what does that look like in your programs?
Definitely. People in addiction, no matter what it is, or mental health, oftentimes kind of lose themselves, lose their purpose, and are lost in what they're doing and what's happening, and you lose control kind of everything around you. And the things that seem normal to us day to day, like a routine, going to bed at the same time, waking up at, like, sleep hygiene,
Right.
nutrition, what we're eating, how we're eating, what we're putting in our body, how that fuels us, how that makes us feel inside, but as well as being connected with a community that surrounds you, that's a positive community. And so the way we treat patients and how we, like, our belief system is, you treat the patient, like you said, as a whole. So, physically, when people come in, no matter what it is, and even if it's people that are functioning, right?
Yeah.
There's a lot of functioning addicts in this world, no matter what their vice is.
Right.
We try to take things one by one, but like you said, the physical aspect and having the holistic approach, where just try to teach them, like, hey, what are the health benefits of just going outside into the sun and taking a walk and clearing your head, or going to sit by the lake or the ocean or the river and just taking in those elements and the natural things, endorphins you can get from. It doesn't necessarily have to be exercise, but it can just be something different than what your body is used to get that natural flow of dopamine and endorphins. spiritually, addiction, it doesn't matter what you believe in or what religion you are, we always try to teach people, try to believe in something bigger than yourself. So it doesn't have to be AA, it doesn't have to be NA, it doesn't have to be God, but whatever that looks like for you, spirituality is huge, because if you can connect spiritually with something and believe in something bigger than yourself, it brings purpose. And when you have purpose, it kind of lays that like foundation for you to be able to start, making your way down a path that is better for you. And then the mental aspect, ties into all of that, because when you have community, when you have spirituality, when you surround yourself with people who are trying to achieve similar things as you have this support system that you didn't even know was there. But it also offers like accountability for
Mhm.
yourself, to keep checking in every day, to keep making sure you're sticking with your routine and your goals in life.
Yeah, absolutely. So I just love that because there's multiple aspects to us as people. And I think a lot of times, when you think of the substance use treatment or the addiction treatment, it's, very often very focused on treating the initial, disease, and that makes sense. But, you also hear, well, from my experience, with working in it for a long time even at the state level, one of the things I did a lot of was around research. And so, the nature of it being chronic and relapsing, and a lot of things contribute to that. Like, you get, especially when people have gone into a more intensive program, like something like residential, for example, and they go back out, and then it's like way harder because they're not necessarily prepared for
Mm-hmm.
all of the things they're going to get bombarded with. And so to have some of that built in is just incredible, I think, and so important. Um, because the other thing too, as I've gone more into like the inner healing aspect of our health, and some like how trauma is sort of this thread that's common in a lot of these conditions and other aspects of the mental health. So um, it's just it's not as simple as just the disease, right? So I just love that you guys are taking kind of that more whole approach and looking at all of these other aspects of it.